Hello, everyone. Welcome to my session. I am Dr. Donghun Lee. I'm an assistant professor in the Department of Counseling at the University of Texas at San Antonio. Little bit about myself. This is my eighth year as a counselor educator. This is my third year at the UT San Antonio, and it's my honor to present one of the studies that are close to my core research agenda at 2025 SKKU and Ajou International Conference. Today, the program that I would like to present is Understanding Burnout Phenomenon Among Professional Counselors. Burnout has received significant attention in counseling research because of the unique nature of counseling work. Many researchers have investigated burnout phenomenon over several decades, focusing on counselors' actual performance in working with clients. And these studies have suggested a decent definition of counselor burnout as a state where counselors experience considerable difficulties in performing proper functions and providing effective counseling. The one that I got from one of my literature review was a reduced sense of personal accomplishment where the individual blames himself, not the circumstances, for his feelings, emotional and physical exhaustion, occupational fatigue, cynical attitudes, depersonalization toward or withdrawal from clients, chronic depression, and increased anxiety. And further efforts have been made to better understand cancer burnout by examining the relationships of three core dimensions, including emotional exhaustion, depersonalization, and reduced personal accomplishments. There is a common argument across burnout studies that emotional exhaustion is the central quality of burnout and the most obvious manifestation of the syndromes. Researchers articulate these relationships that emotional exhaustion may first trigger depersonalization, and this depersonalization can then cause decreased personal accomplishment. There have been slightly different findings as well, and they have suggested that exhaustion may lead to depersonalization and reduce personal accomplishments at the same time. And some research has provided distinctive relationships among these three dimensions, indicating that emotional exhaustion may result from increased depersonalization and decreased personal accomplishment. Um, and Lee and colleagues in 2007 expanded this three-dimension model considering organizational and personal sources of burnout. And so they added two dimensions, negative work environment and deterioration in personal lives, to the three core dimension of burnout, which advanced this model to a five-dimensional burnout model. So using the five dimensions, they introduced cancer burnout inventory, CBI, and it is the first scale aimed at measuring professional counselors' burnout symptoms, integrating the expanded theoretical constructs of burnout with the five dimensions, including exhaustion, incompetence, devaluing clients, and negative work environment and deterioration in personal life. The five dimensions reflect various levels of a burnout among professional counselors. Negative work environment refers to another core dimensions of cancer burnout from the cancer burnout inventory. It captures the organizational and contextual sources of burnout that go beyond personal feelings or client interactions. Deterioration in personal life refers to the spillover of work-related stress and exhaustion into counselors' personal lives, leading to strained relationships, reduced self-care and difficulty in maintaining life balance. And it captures how burnout doesn't stay confined to the counseling settings. Actually, it extended into personal and social functioning, affecting emotional well-being and quality of life outside work. But despite such advanced definitions and continued research on cancer burnout, attempt to understand the expanded structure of cancer burnout using these five dimensions remain limited. So and the CBI cancer burnout inventory has demonstrated its fitness in multiple burnout research using the five dimensions, especially to explore the relationship among the dimensions and to understand the sequential process of the five dimensions. So understanding this underlying sequential process will allow counseling professionals to detect burnout-related symptoms earlier and develop prevention and intervention plans accordingly. So my colleagues and I developed a developmental process model by drawing this hypothesized sequential model beginning from negative work environment to developing clients through deterioration in personal life, exhaustion, and incompetence. So we wanted to validate this model through path analysis, and and this is our research. So a total of 359 professional counselors who are currently practicing and affiliated with one or more professional counseling associations participating in the current study. In terms of demographics, 281 participants identify themselves as female and 76 as male. And about racial and ethnic identity, the majority of the participants identify themselves as white. 33 participants identify themselves as African American, Black, 20 as Asian American, and 19 as Hispanic, 2 as Native American. And the participants came from K-12 school environment, outpatient, private practice, counselor education, university counseling centers, as well as medical and psychiatric hospital settings. Years of experience ranged from 1 to 47 years with a mean of 11.4 years, and standard deviation was 9.6. And the participants displayed a diverse specialty. We had school counseling specialties, mental health counseling, marriage and family therapy, rehab counseling, and other disciplines. And we utilize cancer burnout inventory, which was a 20-item self-report inventory used to assess professional counselors' burnout. And obviously, it consists of five dimensions, including exhaustion, incompetence, negative work environment, developing client, and deterioration in personal life. So these five dimensions reflect the characteristics of feelings and behaviors that indicate various levels of burnout among professional counselors. The cancer burnout inventory asks participants to rate the relevance of the statements on a 5-point Likert scale, ranging from 1 to 5. When it comes to data analysis, we first explored descriptive statistics of demographic variables to understand the sample characteristics, including gender, race, age, employment status, work setting, specialty, and years of experience. And to examine the relationships among the five dimensions, we conducted a correlation analysis. And after identifying the correlation metrics, which confirmed significant relationships among the five dimensions, and then we've tested the hypothesized process model with a serial mediation using a path analysis. And um, the whole procedure, we started with a saturated model where all possible direct paths were identified using the streaming method introduced by Mayers and colleagues in 2013. We successfully removed the least statistically significant path from the previous early models until we found a model with all significant path. And the model goodness of fit, so fitness, we checked we checked the root mean square error result and Ramsey standardized root mean square residual comparative fit index and Tucker Lewis index, uh, um, and so forth. And the first model, so this is the result of the path analysis we conducted. And the first model was identified drawing all possible direct paths among the variables. And the model fit indicated were not calculated as this was a saturated model. And the model indicated the four of the 10 drag paths were not statistically significant, with p-values ranging from 0.065 to 0.145. So among them, the path connecting deterioration in personal life to developing clients was the least significant. And according to the trimming process, and this path was removed to identify modify model one. And the modified model one was found to include two non-significant paths connecting negative work environment to incompetence and negative work environment to developing clients. So they were also removed. So the modified model 2 identified only one path that was not significant, which connected negative work environment to developing clients. And so this path also eliminated. And finally, the model 3 uh, rendered significant direct path only with excellent model fit indices and was retained as the final model. And we have a table summarize the model fit of the final model. And this retained model, the indirect effect involving all three mediators, deterioration in personal life, exhaustion, and incompetence, were found to be significant in a serial chain. So the total effect of negative work environment on developing clients, um, in addition to the mechanism of counselor burnout with all three mediators, the final model also identify effects involving part of the five dimensions. Among them, a significant findings related to the one without exhaustion. According to the model of ours, Without exhaustion, negative work environment may still lead counselors to devalue clients through the deterioration in personal lives and the feeling of incompetence. This finding is significant given that a variety of burnout theories and research have posited exhaustion as a key concept of burnout, insisting that emotional and physical depletion of counselor would lead to feelings of incompetence and devaluing clients. And distinguishably, our findings suggest that even when counselors do not necessarily experience emotional and physical exhaustion or not aware of such experiences, the counselors who work in an unfavorable work environments that negatively impact their personal lives for a long period of time may feel unable to maintain their effectiveness as professionals, and so become, callous about their work and clients as well. And okay, and lastly, our serial process model confirmed devaluing clients to be the final stage of counselor burnout. And according to Marcellus, devaluing clients begin with the action of distancing oneself emotionally and cognitively from work, which can be a way to cope with emotional exhaustion. In fact, emotional detachment from work can be viewed as a somewhat functional and even a necessary action to take, to maintain effectiveness as professional. And maintaining proper emotional distance from clients and creating a clear boundary from work may act as an effective coping strategy for dealing with emotional and physical exhaustion. However, emotional detachment from work, despite its virtue as a potential coping strategy and an ethical practice, can be aggravated by emotional exhaustion through the perceived lack of competency as a professional counselor. And such a detached attitude may lead counselors to become cynical toward clients and to contemplate leaving the counseling profession. As the process model indicates, a negative work environment could significantly affect counselors' social, emotional, cognitive, and behavioral aspects in order, which may harm their clients and the profession. Um, so, so there are some implications for counselors and counselor educator. So, so counselors may use this model to examine their environments and experiences and to engage in self-reflection, assessing whether they have any signs of burnout. A single experience that may not have already necessarily been considered an indicator of being a developmental phase of cancer burnout, such as a limited number of coworkers who can provide case consultation, supervision, or reduced quality time with family and friends because of the limited free time can now be perceived as early sign of cancer burnout that require intervention, which means that they may still be in the early phases, and they have potential to bounce back if they seek help and receive early intervention. Given the gravity of more severe symptoms of burnout, counselors may utilize this model to detect the early sign of cancer burnout and develop strategies such as self-care or help-seeking plans so they can avoid progressing to the later phase of cancer burnout. failing to take immediate action and receive appropriate help can lead to a serious problem, resulting in not only violating ethical obligations given to all counselors, but also potentially harming clients. Specifically counselors exhibiting the symptoms of developing clients, but failing to take any action may violate the two core values of counseling profession, non-malfeasance and beneficence. And the American Counseling Association Code of Ethics in 2014 stated that professional counselors should avoid causing harm to their clients and work for the good of the clients by promoting their mental health and well-being. By devaluing clients as a result of experienced burnout, counselors would essentially devastate the therapeutic relationships with their clients, impair their own ability to promote client well-being, and ultimately cause serious harm to the clients. Implication for counsel educators and clinical supervisors. As counselors take primary responsibility for detecting the symptoms of burnout, counselor educators and supervisors should continue to support them by guaranteeing adequate supervision and continuing education that provides an opportunity to discuss burnout experiences. Supervisors may set aside time during the supervision sessions for a genuine discussion to help counselors better address their burnout and encourage them to regularly adopt the sequential model of the current study to assess their experience pertaining to the five dimension. Continuing education may also focus on early warning signs of burnout, which in the current study were negative work environment and deterioration in personal life, so that supervisees can take immediate action when detecting the signs of burnout. Encouraging counselors to monitor their sudden changes and stressors at work and in their personal life and maintain a balance between them could help them seek support from supervisors and professional counseling. So when counselors show the cognitive and behavioral patterns of developing clients, which is the last element in the sequential process of cancer burnout, supervisors should take immediate action to protect both clients and their supervisees, because it may signal more serious level of burnout. So, therefore, supervisors need to maintain an open and inviting atmosphere to not only allow conversations when supervisees feel less empathic toward their clients or disinterested in their clients' lives, but also initiate further discussion for creating innovation strategies that are effective at mitigating impairment caused by burnout. Supervisors also should be mindful that some counselors may be reluctant to discuss their burnout symptoms with their supervisors because of fear of negative evaluation. So having a conversation regarding their burnout in a more confidential relationship, such as counseling, would be more effective and safer for the counselors to evaluate their impairment accurately and take actions as necessary. And so this is the reference for you to look into if you're interested. And so I would like to thank you again for listening to my session. So if you have any question about my research and presentation, please contact me via donghun.lee@utsa.edu. So thank you again, and hope you have a great conference experience. Thank you.